Good morning. I am getting ready to head to the cancer center for my second IV infusion treatment for iron anemia. I hope for not the side effects that I had last time. So my husband's going with me this morning. We have to be there early. It's about a 45-minute drive, so I'm getting ready to go. Again, if I'm lucky enough to get a little cubby room like I did last time, I will record an update. If not, then it'll be when I get back home or in the car, because I don't want to invade or intrude on anyone's privacy, because it is a cancer center and there are many people there getting treatment for different issues. So, some of the side effects, just to go over again, that I had last time, where my hot flashes were 10 times worse than I've ever had. And I had really severe pain in my back and legs. I have arthritis. I don't know if it was just the weather or combination from the treatment and that. My agitation level was exasperated more than it's ever been. And trust me, I was not a very nice person. And then also the calves on both legs. You know, when you are low on potassium or you are severe anemic, you can get those muscle spasms in the calves of your leg. Well, I didn't actually have the spasms, but I had the severe soreness from having them in both calves, which made it really hard to walk. And that lasted about 3 days. So I'm just really hoping that I don't have these side effects this time. My energy level, I can't tell a difference. I have no makeup on, sorry. Just, it's an early appointment and taking care of the animals, trying to get out of the house. I just don't have time nor the energy to even bother putting it on. So I will update as I can and let you know what's going on, what they said, if my iron level improved from the last treatment last week to this week, and so forth. So until then, bye. Okay, I just arrived here at the cancer center. I'm back in a little cubby, and I'm waiting for the nurse to come put the heating pad on and the IV. I just had my lab work done, so basically I am just waiting. So I will touch base once everything gets started. Okie dokie. Okay, they just came in and the iron, hemoglobin, whatever you want to call it, is already been pushed through. Now I have 30 minutes of the saline to help push it all back in the system. I had some questions as far as my iron level, when they would check it again to see if this was working. They did not check my iron today. They just did a CBC to make sure I don't have any infections or anything before they start the procedure. As you can see, I'm very pale. First treatment, really see no difference. And as I stated earlier, the side effects were miserable. I'm hoping I don't have to go through all of that again. It would be better if I didn't have to go through any of it again, but we'll see. They will recheck my labs in 5 weeks, because apparently it takes about that long for it to boost your iron in your system. So I will have lab work in 5 weeks. If there's no improvement, then I'll be back here. So I don't have a follow-up appointment with the actual hematologist and the oncologist in 4 months from 2 weeks before Valentine's Day. I've got the card in my car somewhere. So anyways, I've got the saline going through now. I have an impatient husband. Go figure. So we are just sitting here waiting for the saline. So I will follow up later at home if the side effects are doing what they did last time or if there's anything different. I did not notice the iron taste in my mouth today, so maybe that's a good thing. I'll just keep my fingers crossed that I'm not as miserable as I was last time after the treatment. So I will check in later on today and give you an update. Okay, I just finished up with the IV infusion. I am getting ready to head home. I have a stop or two to make, and then I'll be there. I will post later any side effects. They did tell me I explained the side effects that I had last time. So they told me anything like that, if it gets worse, to call and let them know. I don't have lab works. That they wait for lab work for 5 weeks, I guess, to give time for the iron to get in your system. But I've explained my episodes of fatigue and what little amount I do of the mornings, and then I'm just wiped out for the day. So if that continues after a week or so, I am to call them and let them know so they can do lab work sooner to see if I need to have more treatments before my follow-up visit in 4 months. So as I said, after I get home, get settled in, any adverse effects I will get on and post, and then definitely tomorrow I will let you know how my night went, because those of you that watched my day after, you know I had a really rough night. So let's just keep our fingers crossed that the side effects are nothing like they were before. So I'll check in later.